This is Kayla, our 17-year-old patient. Kayla was a new patient in our office a few months ago, and her chief complaint was that she didn't like the color of her teeth or the spaces between them, leaving her a little self-conscious when she smiled. What I'm going to show you today is a combination case of whitening, cosmetic bonding, and a procedure known as Lumineers. A few weeks ago, we fabricated home whitening or bleaching trays for Kayla, and she's been whitening in the comfort of her own home and is at the desired shade, so the whitening portion of this case is complete and her current shade is B1. Now if you look a little closer, you can see the diastemas or spaces that she didn't like. What I've proposed is that we take a small amount of tooth structure off the distal or far edge of both front teeth and place Lumineers on them. A Lumineer is basically a very thin piece of porcelain that is bonded to the front surface of the tooth, covering, straightening, changing the size, shape, or color. Typically, a Lumineer case will involve 8 to 10 teeth, but because Kayla's front teeth are set back slightly and she is at her desired color, we are able to do the case with only 2 Lumineers. Let's go ahead and prep those 2 teeth now. Such a minimal amount of tooth structure is removed that she won't need to be numbed, which is a nice feature about Lumineers. Here we have the final prep of the 2 front teeth. The amount taken off will allow for 2 things: increased width of the 2 front teeth to close the space without making it appear as if she has 2 gigantic front teeth, and it will also allow for a little extra room for bonding of the 2 adjacent teeth. Now that we have the 2 front teeth prepared, we can address the 2 adjacent teeth. For these 2 teeth, I will be removing a small amount of tooth structure from the front to decrease the flare of the teeth. Again, no anesthetic will be used, and then bond composite to close the spaces. With bonding complete, it is time to take an impression. We will send this impression to the lab in California and have Lumineers fabricated for the 2 front teeth, which will close the last space. Kayla will return in 3 weeks to have them cemented on. Kayla has returned to have her 2 front Lumineers seated. We will begin by polishing the teeth. Acid etch to increase bond strength, and add a few layers of primer. My assistant will hand me the Lumineers one at a time with cement placed on each one. I will place them, clean up the excess cement, and they will be cured with a light. Open contact, check with the floss, and check the bite, and then we're finished. So to recap, the total procedure for bonding and Lumineers only took 2 appointments without any anesthetic, and Kayla whitened approximately 2 weeks before the procedures were started. I'm going to hand Kayla the mirror and see what she thinks.